And just in the first few moments of this meeting today, to understand how much is already being done in terms of collaboration and coordination.
The previous marketing season is described as a successful one in the cashew value chain. Expectations are high for this year's marketing as stakeholders look at pre-marketing strategies. Ominjai, Grts.
The Ministry of Tourism and Culture, in collaboration with its satellite institutions, the National Center for Arts and Culture and Gambia Tourism Board, wish to inform the general public that it is not part of, nor does it endorse or support the proposed Miss Tourism 2014 beauty pageant slated for this weekend. A news release from the said ministry states that it is disassociating itself from the said event simply because it falls within the mandate of the Ministry of Tourism and Culture through the Gambia Tourism Board to organize a Miss Tourism event and not any other private entity. The Gambia Tourism Board, the Dispatch Arts, has plans to and is fully capable of organizing a Miss Tourism beauty pageant with a national scope and with all the rules and regulations guiding such events fully respected. Furthermore, the dispatch states, it is the duty of MOTC to protect the Gambia tourism brand and not allow it to be used or even abused by any other person or entity. In addition, the news release reveals there is in place a National Ministerial Committee on Beauty Pageants and Films under the NCAC, which has laid down guidelines for the organization of such events as beauty pageants and film shoots. The rules set by this committee must be scrupulously respected and adhered to by all persons and entities that wish to engage in such activities. It states, persons and entities wishing to do beauty pageants, film shoots, or premieres, the release says, should first seek authorization from the committee, which is under the NCAC. This committee, it states, is meant to ensure the protection of our Gambian girls from exploitation and harassment by errant beauty pageant organizers and film producers. The MOTC and its institutions wish to firmly disassociate themselves from the proposed Miss Tourism 2014. The dispatch ends. The pilgrimage to the Kingdom of Saudi Arabia is inching ever closer, and intending pilgrims and their sponsors are expected to start preparing for the spiritually rewarding trip that is obligatory on all Muslims who have the means and capability to do so. Officials of Gambia International Airlines and National Hajj Commission are meanwhile on a sensitization tour of the country. Modu Bajan has more on this year's Hajj package.
Of the 2014 pilgrimage to Mecca or otherwise Hajj, the Gambia International Airline, in collaboration with the Hajj Commission, embarks on a sensitization campaign on this important pillar of Islam. As revealed by the Public Relations Officer of the aviation company, Babukar Fati, this nationwide engagement is nothing new as it is done annually.
As we do every year, the National Hajj Commission and Gambia International Airlines would embark on a nationwide tour to discuss and sensitize the Gambian populace about the upcoming Hajj. This year, of course, is no exception. The team is set and they'll be leaving soon after this program. They will take off from Bara and trek all the entire country for a number of 14 days. During the process, they'll be, first of all, we would like to thank the entire Gambian populace for patronizing Gambia International Airlines during their Hajj program.
Hajj is in many ways different from the other pillars of Islam, as it is required only once in a lifetime. Notwithstanding, the GIA PRO spoke of the rationale behind the sensitization, saying among other things that it is carried out as part of activities engineered towards liaising with the public in order to ensure a fruitful Hajj.
We'll also discuss with them how we intend to proceed with this year's Hajj, and also we'd like to listen to them so that they can give us feedbacks, some of the problems that they feel can enhance our Hajj program. Also, the platform will be used as an open one for discussions. People can come with their views, question and answer sessions, and we will also tell them the plans that we have for this year so that we can have a better Hajj.
Other speakers also revealed their anticipation of a very successful 2014 Hajj. Having done this, PRO Fati, who thanked their past and prospective clients for partnering with the national carrier, further mentioned Gambia International Airlines' track record of successful Hajj operations before adding his optimism of another well-done Hajj.
On behalf of Gambia International Airlines, I would like to seize this opportunity once again and the entire Gambian people for patronizing Gambia International Airlines and the Hajj Commission.
Given its importance as one of the 5 pillars of Islam, Hajj is described by many scholars as a challenging religious obligation, as it entails physical, moral, and economic commitments. In this regard, a dynamic educational approach with previous and would-be pilgrims geared towards enhancing a satisfactory 2014 Hajj for all and sundry may verily serve its cause. Modu Bajan, Grts News.
For decades, researchers and frontline health workers have been striving to consign tuberculosis to the history books. Although there is a measure of success, the advent of HIV and AIDS is threatening to erode gains made in that domain. For TB is one of the opportunistic diseases that capitalize on low levels of immunity. Uminjaya has more on what caused TB as well as signs and symptoms exhibited by patients.
Tuberculosis is caused by a bacterium called Mycobacterium, a bacterium that is spread from person to person through airborne particles. The disease primarily affects the lungs, but it can equally affect organs in the central nervous system. However, there are early signs of the airborne disease, which includes night sweats, fever, pain in the chest, and continuous coughing, possibly with bloody mucus, which health experts believe is the commonest sign of the disease. It is a clear fact that the airborne disease is found in the Gambia, but yet it is curable. Many strides have been taken by the Gambia government through its health ministry towards reducing the spread of the disease by providing 36 dot centers across the country. These centers provide medical treatment for any person found infected at an early stage, thereby ensuring that its escalation is limited. The National TB Control Program Manager, Adama Jallo, told the state broadcaster that tuberculosis is a curable disease and therefore taking proper treatment as diagnosed could solely kill the bacterium in the system of infected persons.
Like the name implies, airborne disease, if a person has tuberculosis, he can cough or sneeze the bacteria, and somebody near the person would breathe in the bacteria.
Jallo clearly spelled out that precautions like covering mouths when coughing can reduce the spread of the disease.
One of our strategy in TB control program, which we have been reinforcing in most of our IEC, is the information, education, communication, both the media and the electronic and print. We have always been emphasizing the various methods of preventing, because TB is preventable. If a person has TB, first he is diagnosed and is put on treatment. And one of the reasons why we put patients on treatment is to cut down the number of bacteria and eventually to cure the patient. And that is why we always observe that the patient is taking treatment in our present. And once the patient is ensured that he is taking treatment, the other issue is when the person coughs, one of the issues we usually tell the person is to cover the mouth. And if you are coughing or sneezing, just have a handkerchief and a tissue paper and then cough close to your mouth, rather than coughing discriminately or spitting discriminately.
The dot treatment that the Gambia government has been using is believed to be very effective in tackling the spread of the disease.
DOT is direct treatment shortcut observation. That is, you observe the patient taking treatment. And we have 36 centers across the country. Patients who are diagnosed are treated in these centers, and they are observed whilst they have been given treatment by our healthcare workers. And many a times the patient can be given treatment at home. We have village healthcare workers, and even the family participating in supervising the treatment of the patient. And that's why if a patient comes to our clinic, we always ensure that the patient comes with a relative, so that the healthcare worker will tell the relative or a friend or the village healthcare worker as to how the patient should be supervised when taking drugs.
Despite the very effective DOT treatment, there are still patients who fail the first line of treatment.
Sanatorium are cases that when they start the first line treatment and they fail, those are some of the patients that we usually admit. And
okay, that's the time they're taking.
Yes, taking care. But like I said, all the centers in this country are equipped in terms of diagnosis and treating.
Tuberculosis is a preventable and curable disease. However, medical experts are